Hey y'all. Since I'm finally finished with doing work, I wanted to make a video kind of discussing like basically what a nurse practitioner is and what they do, because I think that is a lot of confusion about that. I'll tell people like, "Oh yeah, I'm a nurse practitioner," or even patients and stuff, and they be like, "Huh?" So, anyways, a nurse practitioner has the ability to um, prescribe medications and see patients for like different things. So, nurse practitioners or family nurse practitioners, I should say, which is what I am. You can see patients for like primary care things. Some family nurse practitioners work in urgent cares. Some work in like specialty areas as well, as long as they don't go like, to like, out there scope and stuff with specializing, and they can even work in specialty areas like women's health, clinics, and things like that, where they can do like pap smears, prescribe birth control or whatever. So the difference between a nurse and a nurse practitioner is just the level of, I guess, I don't want to say like authority, but the level to which you can pretty much practice. So as a nurse practitioner, you do have the ability to order medications, and come up with a treatment plan for patients. You can order a referral, order referrals and things for patients too, if they need to go to like physical therapy, or they need to see some kind of specialist for like cardiology, or, things like that. Nurses, on the other hand, do not have the ability to be able to prescribe medications, or be able to like, obviously write out a script for a referral and, see patients as a primary care provider. So that's pretty much the difference. It's just like it's more independence. And I like to tell, like, I kind of like to phrase it to people as like, we're considered, nurse practitioners are considered like providers for the most part, because I think, to me, that just makes it a little bit more easy to understand. I think that we do differ from physicians a lot because we do have a nursing background. So we tend to probably have, in my opinion, more bedside manner with patients, because, either we've been working in a hospital or we've been working in some other setting as a nurse. So we just tend to have that background of experience and tend to kind of, I personally feel, be a little bit better with seeing the whole picture, and maybe being, sometimes I feel like taking a little bit more time out to talk to people or talk to patients about certain things, because to me everything is like interconnected. So patient might be stressed out and their blood pressure might be high. Well, their blood pressure might be high because they super stressed out. I mean, it's just a lot of different things that go into health. So I think nurse practitioners have they tend to do a little bit of a better job with that. But yeah, that's pretty much like the difference. Nurse practitioners, pretty much you can see them as a, like a primary care provider, or I don't want to say gynecologist, but you can see them for a gynecological visit, depending on, where they work at and stuff. You can see them in the urgent care. If you come in there, you got strep throat or whatever you think you have, and, they can see you for that, and prescribe whatever for that. So those are pretty much the differences, and that's pretty much what a nurse practitioner is. I think the term is a little bit confusing, but I just kind of wanted to make a video so that people would actually like understand, because I get so many people that like, I'll tell, oh yeah, I just finished school, or oh yeah, I just passed my test, and they're like, oh okay, so you're a nurse. And I'm like, I am a nurse, but really at this point it's considered more like a provider. And it's like I have a hard time saying it without sounding like, arrogant or something, because I don't want to come off like that. But that is pretty much it, y'all. I'm super tired. I went to a group home today, and then I came home, and like documentation took quite a while, and then stuff had like meds had to get reordered, and then billing had to get done. And this is just kind of like a side note, but it's just so different. It really like your experience as a nurse practitioner, even, and for those who are nurses and stuff too, like practicing on that level, it, your whole experience just depends on like where you work and stuff. And right now, as I've said in like my other videos and stuff, I'm working with a nurse practitioner that has like her own practice and stuff. So some of the things that you have when you're like in your normal office setting is a little bit different. Like me or her may draw somebody's blood. We may do certain things that typically in an office setting we wouldn't do. More so the medical assistant or somebody would do it, or the nurse or somebody would do it, So it's just a little bit different in that aspect. And then another thing too is like having to do some of the clerical things that you may not have to do in the office. So like I had to try to call and get a prior authorization. That did not go through. So then it has to go to something called a peer-to-peer, but that's a process, that's a whole long process. And typically, like I've had to call for prior authorizations when I was working as a nurse, before I became a nurse practitioner. So basically, some of the things that you have to do when you are in your own business, especially when it's like a smaller, practice or whatever, you may have to do those extra things, those clerical things, and that stuff can get very, very time consuming, but you have to do them because you might not have all these people to assist you with it. So you do grow an appreciation for I have a big appreciation, of course, for nurses and stuff, and for like medical assistants, nurse aides and stuff. And I've started from the bottom, y'all. I was a nurse aide when I first started off, and then I became a nurse. And so even when I was working like as a nurse on the floor, I was that one who would like not really ask the aides to do stuff a lot of times, and I would kind of just do it, even sometimes when I like probably should have asked them to do it because I didn't have a whole lot of time. But I was that person because I started off as a nurse aide, and so I kind of know what it's like when you have a nurse who does not want to help do anything, like they think they too good to change a brief, or they think they're too good to go and draw somebody's blood sometimes, or they think that it's just certain stuff that they shouldn't have to do. But the reality is that you cannot have that mentality. That's a very ugly mentality to have. That's why I always like to highlight to that I am very proud of like where I've come from and stuff, but I do not forget where I came from, even despite the position that I'm in now, and I'll be honest, like it's some nurses out here, like RNs working on the floor who have been doing it for several years and years and years. And I'll be honest, they probably know a lot more things in certain areas than I do because they've been around it for so long. Like I was an RN for 5 years, and then I went to school, to become a nurse practitioner. So total, I've been like a RN for 5 years, and then just, gained the other title. But, I'll be the first to say it's some RNs out here, they know their stuff. They've been doing this for like 20, 30, 40, 50 years and stuff, and it's on the floor at that. So I really commend them because I'm like, I could never work on the floor for that long, not at the bedside. And then, your aides and stuff, same thing. It's some aides out here who have been aides, for a very long time, and they may even have some more knowledge than the nurses and stuff. So, I just try not to ever, you know, you can't think too highly of yourself ever, because you have to realize that y'all all depend on each other for something. And it is very helpful, like when you have good, you're a nurse, you got good A's, you ain't got to worry about getting no sugars or whatever. You can just pass your meds. That makes your life much easier or whatever. And then it also makes A's lives easier when you got a nurse who's willing to help. Oh, this person got to go to the bathroom, I'm already in here, let me help them. Same thing with nurse practitioners or physicians. You have some that's willing to, like, oh, let me get this blood real quick, it's cool, I'll get it, I'll ask this patient some more stuff and determine what I'm going to give them med-wise or whatever while I get their blood. It's some scenarios that are like that. And then in my scenarios, like, we don't have all these people to be doing all that, drawing blood, doing whatever, so we have to do it. So yeah, like, just kind of got sidetracked, but I just kind of wanted to make a video about what nurse practitioners do, and just highlight the fact that we all are, like, important still, regardless of how much education you have, where you work at, how much money you make, and all of that.